proudly brought to you by the National Center for Wellness.
The concept that, and you alluded before, that the methods that we use and the thought process that we use, so many people confuse the fact that our world is getting healthier, we're advancing. I would agree that our healthcare system, our medical system, has never had better tools and better knowledge and better ability to not only treat disease, but to diagnose it. We've never had a better opportunity to understand what's required to express health. That, we all live indoors. We have plumbing, heat. We've got, sanitation, refrigeration. And with all of this, our health should be improving and our need for intervention should be decreasing. Yet we've never had a time where people are taking more drugs and getting more vaccination and we're getting sicker. And at some point, someone on the inside needs to stand up and say, enough. This is ridiculous, because clearly what we're doing isn't creating the results we're after. And I don't understand how that conversation takes place or how those people sleep at night with the knowledge that clearly we're headed in the wrong direction. It's like we're in a car speeding towards the cliff. We've gone off the cliff, but because we haven't hit the ground, they don't recognize a problem yet. And it scares me to death to think the world my children are going to live in and they're growing up in, that our leadership is so blindly following and trying to lead in a direction that is headed in absolutely where we don't want to go.
That sums it up perfectly. And it really does. I mean, medicine has not advanced in 50 years. Technology has. We have the highest tech widgets and gadgets to diagnose the most unbelievable teeny tiny things that drive the cost of our healthcare through the roof. When if we would just focus on eating, the basics, right? Eat good food, go to bed on time, wash your hands, get a little exercise, drink plenty of water. I love the stated mission statements of the American Academy of Lifestyle Medicine. Until last year, I didn't even know this existed. But I like their tenets, and their tenets are eat real food. Real food, not stuff in a box isn't real food.
Right.
Eat real food. Mostly fruits and vegetables. Eat mostly fruits and vegetables, and don't eat so much. Have smaller portions. Nice. And just that change could transform the healthcare of millions of people across this country.
Absolutely. Dr. Katz, I was going to say Dr. David Katz from Yale is in the preventative medicine arena and talks about in his book, Disease Proof, 80% of chronic disease can be eradicated simply by changing your diet to eating things that grow, as opposed to things in a box. And I explain it to my patients that food, when you leave it on the counter, goes bad, and any food in a box that outlives food that can last on a counter technically isn't food. So when you just because you can eat it doesn't make it food. I explain it to my 3-year-old as well. So he talks about 80% can be changed simply, like you said, by changing the food, and I love that you said the quantity and quality as well, and by exercising, and that alone will do 80%. And he admits there's nothing in medicine that's able to get an 80% improvement, that's able to get that successful a change in a patient's health. And it's something so fundamentally simple. At the National Center for Wellness, we have 5 feats that we talk about. And the F is for food, and like you said, food that grows. The E is engagement, and it's engaging in things you're passionate about, that literally light you up. You asked me, why I do this. This is something that lights me up. It excites me, and it's something that I'm extremely passionate about, just like you are. The A is for activity, move more. The T is for think positive thoughts, and the S is for sleeping, rest, meditation, things that recharge your battery. So, you're dead on, and I think that one of the turning points for this healthcare conversation is going to be epigenetics. It's going to be the impact of how your lifestyle dictates your quality of life. And when it, I was just going to say,
and that's the thing. Yeah, sorry.
no, you're wonderful. I was just going to say, unfortunately, I don't think this debate's going to change because people care about health. The conversation's going to change because of finances, that we're going to go bankrupt and we're not going to have an opportunity to keep going in the direction we're going. And we're going to be forced to change directions. And with that, it'll be an alarming wake-up call that what we've been doing has been so grossly in the wrong direction that people will categorically start to change their behaviors and change their quality of life.
And the epigenetics question, going back to the whole topic of vaccines, I think is hopefully going to be one of the cornerstones that will start to change this.
Absolutely.
I was at a conference a few years ago that they talked about how many, there were like 1,500 different genes that are possibly mutated at the time of birth. And the body has the ability to work around that, and say, okay, this isn't working, so we're going to change it to that, and we're going to adapt to this. And I think that once we get down the path, I just read an article the other day. It was called Genotyping Your Baby. And I really feel like that has plus minus connotations. It depends on what genes they're looking for and who's going to house that data.
Right.
Because if you have a baby that's born and they do this big genetic mapping on your baby and they go, oh, wow, looks like this kid's going to end up with heart disease and high blood pressure when they get older. What does that mean? And who holds that data? Is it the insurance companies? Is it the drug companies? Is it the government that holds that data? Because now we've got Obamacare and we have to think, who holds the data?